So who are transgender people? Well, very simply, transgender and gender diverse people experience their innate sense of identity and their connection to gender as being different to what was assigned at birth. A transgender person might identify with a binary connection to male or female, or might identify as neither or both male and female. Being transgender is about an inner identity, and then this may need to be expressed through medical interventions such as hormones and surgery, or may not. Gender dysphoria, within the context of a DSM-5 diagnosis, relates to the distress transgender people may feel about how their identity is not being physically expressed appropriately. It is not a diagnosis about being transgender or gender diverse itself, and being transgender is not an illness or a disorder.
Then you can just put this on all the ones that you want to play for 10 seconds. Just start by explaining that transgender is an umbrella term that refers to people who don't feel that their gender fits into the binaries that we have placed upon gender, and that it does vary a lot from people that do want to transition to the complete opposite gender to people that just want to take it day by day and see, you know, how do I feel like a girl today or a boy today, like how am I feeling, and so that it's not really a distinct, you know, you can't just pick a transgender person because everyone's different in how they present with, you know, what levels of feminism and masculinity, and it's just such a broad spectrum.
I often think of that kind of person who is really looking at the so-called opposite of birth sex as being kind of in the extreme end of this sort of umbrella. And they're what I describe myself as a transsexual rather than necessarily transgender. So, but I know there's lots of negative connotations with the word transsexual because it makes it sound like it's all about sex. It's not about sex. Sex is part of the life of any, not anyone, but most people, it is part of your life, but that's not the issue for me. My body never looked like it should have looked, and I had to do something about it, seriously. And that's a kind of, that's a very special kind of feeling, and a lot of people who are in the transgender umbrella actually don't feel that.
I was just going to add that being a parent of a transgender female, my child from day dot, I would say roughly just before the age of 2, has never referred to herself as anything else but she, her. Even drawing as a very young child, always draw herself with long hair and dresses from a very, very young age, and has never differed from that.
And no amount of sort of retraining or even kidding yourself, like you can't for years, you know, that you can live a different way and overcome this problem will help. You are that way, and you know it is a very core sense of your identity.
We've got this problem where we need very simple medical treatment for something that is relating to our physical cells, our bodies, because it is not our minds that are wrong, it is our bodies that are wrong. We're born with the wrong body. Our gender is right, it is what we feel is right. It is the body that is wrong. So the medical part of this is to fix our body.
There is really nothing in this area at the level that the children need, and we have to travel down to Melbourne to the Royal Children's Hospital for the diagnosis, or the secondary diagnosis at least, to see the professors down there, and for the ongoing treatment. It's I'm not sure about you, Riley, but it was every 3 months for us, which puts a big strain on myself being a single parent.
Yeah, we went there for once a month for a year and a half, and then I had to speak with an endocrinologist, and we did that via webcam because we weren't able to actually get to Melbourne to talk to her. And I only spoke to her once, and that was because before they could allow me to go onto testosterone, I had to completely and utterly understand and acknowledge the fact that I am giving up my ability to have children, and I had to sit down and listen to the methods of egg extraction and freezing and my options to keep them alive and usable, and the options that later in life I can go off testosterone for 6 months and have children. And I had to, if I did not have that little web chat, I was not allowed to go into transition at all. And then because I was already 16, I didn't need puberty blockers. It was too late. My puberty was done. My physical puberty was done. So we then were faced with family courts. If you're underage, you need consent from both your parents, and then you need to go through court, which is expensive and lengthy and time-consuming, and no one wants to do it.
Transgender female at 11 years of age, if this puberty blocking treatment isn't given to her, she'll start going into puberty, the testosterone levels, and her voice will deepen, and she'll receive facial hair, which they say can be fixed by laser, but the deepening of the voice cannot be reversed.
And there'll be structural changes to
in
the brow,
bone structure,
and the nose, and the jaw,
yes,
and the sorts of things like big hands, big feet, all the sorts of
so
height.
there's puberty blocker treatment to prevent all that from happening, so she can transition
And save
thoroughly
probably $100,000 in treatments afterwards.
yes.
Even just with the reconstructive surgeries, having to go and stay in Melbourne for a fortnight to make sure that you can get back to your doctor in case something goes wrong. It's so much money and such a hassle that everything would be better if we, obviously would probably still need to travel for surgeries, but to be able to come back and have doctors here that can, for trans guys, remove our drains and can do revisions so we don't have to drive 4 hours just to, have something looked at.
Yeah, excellent. Well, I've just got another quick point about, once again, we were lucky enough, my family was lucky enough to have my child diagnosed years ago, and I was told by the professors at Royal Children my child was the third child that year to be diagnosed. I've just learnt recently now the waiting list is 12 months for young children to get in to see these doctors down there. Now, if they're young children like my child who desperately need these puberty blockers, that you're risking these children going into puberty in that 12 months and with devastating effects for the near future.
That's right. I mean, my understanding is that people who go into puberty with, and are trying to avoid that, they're at much greater risk of self-harm and suicide, and that's a real concern for any parent.
And the 12-month list is just getting longer and longer every month.
Yeah.
It's just getting so many referrals from all over.
We just need, I think locally, the issue is that when something crops up and you need support or guidance, you want to know that a reliable, knowledgeable voice in the medical community can meet with you, examine you, and give you a thoughtful response. That's all we're asking for, is someone to become somewhat educated, hopefully very educated, in being able to understand the situation for transgender people, whether it's entering into hormones, whether it's just managing their general health as they're engaged in hormone regimes, or whether it's managing their general health like any other patient after surgeries that they may have. And I think that's really crucial. When you feel like you're 4 hours away or 10 hours away, or wherever it was that you had your surgery, away, when you feel you're so far away from actually getting support, it's very anxiety provoking. And I think that's what I'm asking for anyway, is just to be able to go to somebody, to have a look at my case file and examine me and say, oh, don't worry, that's fine. That normally happens with this sort of heat treatment,
I think
you know.
just for our general health full stop, it's very important to have a doctor that isn't going to read your case file and say, oh, you're transgender, and then treat you differently.
Yeah.
We need doctors that know that when you pick up a patient that is transgender, what they're going through, what they need, what their treatment is, where they're at with their treatment, what that means, and really just so that you can have a doctor to respect transgender people properly. And that is, that we can have a doctor to go to about a cold or a broken bone or something, and go in there and feel comfortable knowing this doctor isn't sitting here wondering what my gender is. This doctor isn't sitting here judging me because of that, because I know that this doctor is educated enough to not sit here and judge me for it, and that I can feel safe seeing this person, especially when it does come to things such as, trans guys have to have pap smears. I probably won't, just because I don't want to go to a doctor and sit there going, this isn't really comfortable for me.
People to see the person for the person, not for what they look at their sexuality, or like we were talking about the spectrum, transgender, gay, lesbian. People have got to stop looking at people through those sort of eyes and just see the person, and let this person fit into society instead of standing out and making them stand out and judging them. Yeah, acceptance.